Each year, more than 230,000 men are diagnosed with prostate cancer. My guest today is Dr. William Pierce, a prostate surgeon at St. Joseph's Hospital in Orange County. And he's here to explain the diagnosis and treatment of prostate problems. Bill, thanks for coming.
Thank you, Larry.
Listen, this is a big topic for such a little gland, but it's so important. Can you tell us exactly what the prostate is and where it is?
Well, the prostate is situated here, just below the bladder. And it's an important structure for male reproduction, actually.
What does it do as far as, what does it secrete or?
Well, it's responsible for secretion of the seminal fluid, which allow the sperm to flourish in the ejaculate, and so it's a reproductive gland, really.
So if you did not have a prostate, you can't make seminal fluid, so you probably would not be able to have.
Right.
You'd be impotent or sterile?
You wouldn't be able to reproduce.
You wouldn't be able to reproduce. So what are the big problems that occur with this?
So the big problems that occur with the prostate tend to occur in men over 40, and the two big ones are obstruction from enlargement of the prostate, which is a benign condition, or prostate cancer.
So how does the obstruction occur?
The prostate sits here right below the urinary bladder.
Where's the bladder in there?
The bladder is this pink structure up here. So the urine is collected in the bladder, and it must make its way through the male prostate to make it out through the urethra and into the toilet.
Okay. So the urethra is a small tube that comes from the bladder through the prostate into
That's correct.
Out the penis. So why does it get enlarged? What makes it enlarge as we age? Do we know that?
Well, testosterone is a factor. Hereditary reasons are a very common factor. But a lot of it is genetic, and there's not a lot we can do about that right now.
So if as your testosterone levels go down, your prostate tends to enlarge?
Well, it can happen both ways with increasing or decreasing testosterone, but the exposure over time to testosterone seems to be the real issue. So as a man lives longer, the prostate does enlarge.
So taking testosterone, if your prostate gets enlarged, is not a way to treat it?
It's probably not a good idea.
So if you have prostate enlargement, what are the symptoms that you get? Do you feel pressure down there? What is it?
So many symptoms involve the flow of urine. Men will feel as though they can't empty their bladder well. They may be getting up multiple times at night because they're not emptying their bladder. And a flow that may start and stop, and dribbling with urination are very common conditions.
So the stream isn't as it used to be?
Basically, that's what I hear a lot.
So why at night? Why do people have this? Do they symptoms more at night? Is it just, why is that, do you know?
Well, they find themselves getting up at night because the prostate is obstructing the bladder. So each time they urinate, they don't urinate out very much, so therefore they must get up multiple times to really get the bladder empty.
Does something happen when you're lying down that compresses the prostate more, or?
Well, that's a very good question. The kidneys do tend to make more urine at night because of increased blood flow when we're lying flat, so that is a common condition. And then a lot of people will take beverages at night before they go to bed, and that makes them urinate.
Yeah. So is prostate enlargement, does that mean you have cancer? How do you?
They're really two separate things. Of course, they can both occur in the same gland, but one does not mean you have the other. And they're really, in terms of prostate cancer, there aren't a lot of symptoms of prostate cancer.
So the person who should come to you is the person who just starts to feel a little change in their urinary stream, or should it be the guy where it's interrupting their life? I mean, if you pick up this or treat it early, is it better, or when should they come and see somebody like you?
I think when they start to see the early warning signs of an enlarged prostate, like we mentioned, getting up at night, slow urination, interrupted urination, it's a good idea to be checked by a urologist because we have a lot of different treatment options available.
Yeah. So what are the treatments usually?
Well, we have many medications that have been out there for a long time. We have some newer ones and some older ones. Some are designed to shrink the prostate, and some are designed to actually relax the muscles of the prostate, allowing urine flow to improve. We also have procedures that are available to us.
Do you always try medication first? You don't go right to surgery?
Usually we do.
Yeah. And how would you say the guy comes in, he can't urinate, you do an ultrasound of the prostate, or you do a rectal exam? How do you decide it's enlarged?
Well, a rectal exam is a great way to screen for enlargement. And as you can see here, the rectum is this structure here. It sits right next to the prostate, so I can actually feel a man's prostate very easily with a simple rectal exam.
So you would just put your finger in the rectum and you can feel it in the front portion like that.
Most men don't necessarily like having that done, but it's necessary and it's important for male health.
Yeah. And then do you do any other tests like a
Well,
biopsy if it's enlarged?
there's
or
a
no?
there's a PSA blood test that sometimes is controversial. It's been around a long time. We find it to be a very accurate screening test for prostate problems, and we frequently will recommend a PSA blood test for men over 50.
Okay. So the surgical treatment, is it through the penis, or do you open up the abdomen? How do you fix an enlarged prostate surgically?
So if we're talking about fixing prostate with surgery, it involves going in through the urethra, usually with someone will be asleep for that, of course, under anesthesia.
I hope so.
Yeah, and we will take a laser fiber here and actually open up the inner part of the prostate, that part where the urine needs to go through, to allow a male to urinate better.
So the laser, does it heat it up or cause a
It
lot of
actually
burning, or
vaporizes the
vaporizes?
tissue slowly and carefully, and there's not much bleeding involved with that, which is nice. And then at the end of the procedure, the prostate is now open, allowing a man to urinate much better.
Do they sometimes have problems holding their urine after that? You know, do they have incontinence, or?
That's a very, very rare complication, and in general, I don't see much of that at all, if
So
ever.
So you don't use the, you don't core it out anymore? You just use the laser, the main
The
treatment?
coring out, or what is sometimes referred to the transurethral resection, or the roto-root, or some men like to call it, is still used. We tend to reserve that for larger prostates that require more removal of the tissue than perhaps maybe the laser can do.
So let's talk about prostate cancer, because it's on probably every guy's mind who's over 50. How does that fit in the realm of cancers in men? How does it rank?
So prostate cancer is a very common cancer in males. It's actually the most common cancer other than skin cancer in the male population. So it's very important with prostate cancer to screen for it and to pick it up at an early stage where it's curable.
So how do you screen for it now? What's the new recommendation?
So at age 50, we recommend a PSA blood test as well as a digital rectal exam, both of which are important to detect any lumps or bumps in the prostate that could indicate a cancer, or cancers within the prostate that are making PSA.
How do you do that with the PSA? Then you get a biopsy, or?
Correct. If we have a suspicion that there may be cancer cells within the prostate, or a tumor in the prostate, we'll do a biopsy, which is done again with a rectal probe in the office. Takes about 2 or 3 minutes to do. We give a local anesthetic block, so it's not painful, and it gives us all the information we need to figure out what's going on in the prostate.
So now you have prostate cancer, and do you, if you get it at a younger age, is it a more aggressive tumor usually than if you?
Usually it is. That's correct. And in African Americans, it tends to be a little more aggressive type of cancer.
How do you treat it? What are the treatment courses for cancer? Do you always take it out, or do you what?
Well, in some of the older population, if it's not an aggressive cancer, it can be watched safely. You don't always need an operation. Some men will get radiation treatment, which is available in different forms: seed implantation or brachytherapy, or external beam radiotherapy. Cryosurgery or freezing the prostate is an option for men. And then we have our traditional open surgery, removal of the prostate through the abdomen. And then we have our robotic procedure, which is really the most state-of-the-art procedure that we have now for most men.
Is that part of the robotic arm?
This is. This illustrates part of the
Keep that away from me, by the way.
robotic surgery. But the instrument itself is very, very precise. This instrument hooks up to our surgical robot, which allows the surgeon to move the instrument in many different ways, allowing precision motion. It even takes out any tremor if you've had a cup of coffee. And it allows us to place sutures, hold tissue, and there'll be 2 or 3 of these working at the same time under the control of the surgeon when we're doing a robotic prostatectomy.
And so when you do that, you're more able to preserve the nerves, and there's less complications with this?
Correct. The advantages are several. First of all, we don't need to make a large incision to get access to our prostate. Secondly, we have extreme magnification of the structures that we're looking at through what's called the laparoscope, the camera. And third, there's much of a decreased blood loss compared to what used to be a bloody procedure is now relatively bloodless.
So a lot of benefits.
And then, as you mentioned, we can identify where the nerves to the penis are. They sit behind the prostate, and spare those. So we can spare potency or erectile function in men more easily with this.
We're just about out of time. That's fascinating. So just one last question about this. is this done, is this the standard every place in the country does robotic surgery now, or is it just in a few areas, or?
It's becoming the standard, but I'll say at St. Joseph Hospital we've been doing it since 2004, so we have a very established
wow.
robotic program, and I think that comes into play in terms of outcomes.
Great. Well, that's very informative. So the message is to get screened early, detect it early, and treat it appropriately. Don't be afraid of being screened. Get it done, find out what's going on, and go to the appropriate place for the best care.
Exactly.
That's great. Later in the show,